Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. Professor Kelvin Kong is a Worimi man from the Port Stephens region north of Newcastle in New South Wales. He is Australia's first Indigenous surgeon, an ear, nose and throat specialist working at John Hunter Hospital and John Hunter Children's Hospital. Professor Kong regularly travels to remote Australia to provide ENT services to Indigenous peoples. He was the 2023 NAIDOC Person of the Year and he is my special guest today. Professor Kong, what have been the highlights for you in this role?
There have been many highlights. I think the biggest thing for me, well, a couple of things I probably should say. Firstly, I'm extremely honoured by such a recognition, but I think for me it's really about the recognition of the paucity of ear disease and this dichotomy we live in this health in this country. And I kind of think it's sad that I'm celebrating on the back of a real travesty that we're experiencing in this country. And so it's with mixed emotions that I'm excited about this. I'm really excited because it's allowed me to highlight ear disease in this country. It's certainly allowed me to push for an agenda amongst my fraternity, but also amongst the government to really try and bring awareness and also make change in this area. But also it's really highlighted that it's not about the work I'm doing. We're talking about kids' lives. And for those who are listening, who have children, who have been through some ear disease particularly, you realise how much you struggle and how helpless you feel when you just can't get that help, when they're struggling with sounds, when they're falling behind with reading, when they're falling behind in school. And it may not be the drastic bottom of the class, but just those small things that you want your kids to be the best they can. You want them to dream what they want to dream, and they're just being held back by this silly thing called ear disease. And it's just so exciting to be able to be involved in it. And if I flip that around, the kids I've looked after who have been brought to the attention from this awareness we've had is just wonderful. The funny stories you hear, the enjoyment from the parents, the engagement in the community, the singing and dancing, names being mispronounced, kids' friends' names that the parents mispronounce because the kids mispronounce because they can't hear. And there was one example where one kid was named Tam, and the parents been calling the best friend Tam for ages. And after the operation, they realised the kid's name's Sam, and I was just so embarrassed because they kept calling him Tam, and the kid's going, "Why are you calling him Tam? His name's Sam." And those kind of things are really rewarding. So I think for me, it's been a broad scope because there's so much of that is, obviously been going on for many years, not just this 1 year, but it's certainly highlighted. And for me, maybe it's honed in on how important this work is that we need to keep pushing in this area.
When you talk about the real travesty we're experiencing in this country, what do you mean?
I've always described it as this dichotomy we live in. We live in a country which has probably one of the world's best health systems. And I say that with a hand in my heart. If I'm unwell, if I'm really sick, I'm so glad I'm in Australia because of the care that we can get in this country. On the same token, when I look at the ear disease rates that we have, the non-Indigenous population have a completely different prevalence and incidence and outcome from ear disease than Indigenous kids. And yet this is in the same hospitals, in the same health district, in the same country that we live in, that we're seeing this real distinct difference. And so to me then, when you look at some of the, when you drill down on some of those factors, you can actually see that if you live in a well-populated, affluent suburb, then you're probably going to get the healthcare that you deserve. And I have no issue with that at all, so please don't get that the wrong way. But on the same token then, if you're not in the right postcode or you don't have the benefit of private health insurance or live in an affluent suburb, you're not going to get the care you require, and therefore you're going to fall behind. And so before even starting school, even primary school early on, we're starting to create this different segments of society. And so then when we get to the social determinants, or when we get to some of the parallels down in teenage years and some of the social disharmony, suddenly we're all got and profess this excellence and knowledge in trying to address these issues, when in actual fact, we should have addressed this early on. We should have attacked this much earlier. And when you look at ear disease in the broad spectrum of health problems is not a high priority for most families. If you've got someone having heart attacks, diabetes, strokes, cancer, all these issues are huge health issues. So when a kid's got a cute little lisp or can't hear that well, When you got 100 other priorities, you're not going to put that as a high priority. Yet in my sphere, and certainly stuff I see, I want to put that as number one priority because I think it's going to change the kids forever.
How do we address hearing difficulties in Indigenous children, especially otitis media?
So first thing is that otitis media is common, and otitis media affects all kids. And all kids in Australia endure otitis media in some form or other. What the differences that we're seeing amongst our populations, our vulnerable populations, is that we're seeing otitis media occur at an earlier age, so under the age of 12 months rather than around the age of 3. And we're also seeing a more prolonged incidence of disease. And then we're seeing the complications of disease, whether it be perforation, chronic suppurative otitis media, hearing loss, and all the other subsequent issues that are associated with it. And so we all have the same incident. So we're never going to rid the world of otitis media. It's part of growing up. But what we need to do is be able to address it earlier by finding out what the issue is, by addressing those issues, whether it be infection, which we use antibiotics, whether it be hearing loss, which needs hearing aids, or being up the front of the classroom, whether it be long-term hearing loss, which needs grommets, or whatever it may be. My issue is that we're not actually addressing it, and that's in a very crucial time of the kids' development. Most of these issues, and we're trying to work out why is it that our mob is getting all this kind of disease process, and we struggle with that because I think the usual kind of narrative around that is that it is a problem of the patients and living standards. So, if they just sent their kids to school, if they just stopped smoking, and it really frustrates me because these are such negative, unconscious biases putting the blame towards families, which I don't think experience any of those things. Rather, what I see is a lot of the exposed cultural determinants of health in not addressing those issues. Difficult access because you can't get a bulk billing GP. Hard to get to the GP for a whole lot of reasons. Multiple kids say you got to take time off work to see that. A lot of social disharmony in having single parents which are trying to do that, or grandparents trying to find out how to get that help. Trying to find a specialist is really hard in its own right. Even if you get access to a specialist in the public system, you're waiting 2 to 3 years before you even get help in that instance. And so you add all these things up in the long term of things. There are so many things that we need to be doing as a health profession to actually spin this around to try and do that. How do we create different pathways to get that access to health? How do we create an avenue where primary healthcare realise how important hearing is in the growth and development to make sure that happens? How do we make sure the kids are on top of all the immunisation, the health checks? How do we make sure a basic health check involves looking in the ear and actually checking the ears and hearing and speech and language? How do we link education with the health system? Because we live in and work in these silos where I work in the health industry. And so, for me to write a letter to teachers, my registrars always say, why are you writing a letter to teacher? I think, well, hang on. The whole issue of the kids' ears because of speech and language. Of course, we need to be in this space, but we don't talk to each other enough in those kind of things. So I think to answer that question in a brief way is that there are a multifaceted approach to actually doing this. And we always talk about the notion of it, it takes a whole community to raise a kid. It takes all of us to raise all of our kids. And I guess as a proud Australian, we all should be making sure how we look after each other. And it's how we as Australians bring our people who are less fortunate than us along with us is how it really determines how we shape as a society and what we're doing. So for me, in trying to do that, is that what can I do with my privilege? What can I do in the spheres of influence I have to actually change some of those things? And some of those things that we're working really hard to do. How do I get better access to my clinics because I know how busy they are? How do I do innovative ways to get access to my clinics? Some of the different things that we've done in the hospital, for example, is we've employed an Indigenous health practitioner. Having an Indigenous health practitioner in my practice makes a huge difference in the public system because people start addressing and seeing and believing and actually honouring that respect of having workers in there, having an audiology-led clinic where the audiologist can pick up these hearing losses far quicker than what I can and then funnel them into the system quickly. So I'd say it's kind of small things we can do to add to that. And then when you get all those things on there, the other part from the community perspective is actually having some pride in what we're doing. So it's not a narrative of the unemployed, alcoholic, drinking, smoking person, because that doesn't exist in the communities I work in. It's about how do you actually get the kids and the parents proud of our culture again? How do we encourage the song and dance and link it into some of the health messages, because that's where they see and that's where they engage all the time. How do we actually be proud of that and not be ashamed of having ear disease and getting ears fixed? Some communities I go to, it's normal to have hearing loss. So if you've actually got normal ears, you kind of look down upon and say, hang on, what's wrong with you? You don't have any discharging ears or runny ears, or you're not having antibiotics. And so how do we dispel all those myths and actually get it back into a positive narrative to make sure we're doing the right thing by communities?
It sounds like a lot of problems are to do with socio-economic status. Is this why more children have this ear disease?
Yeah, I think so. I think two things I guess I'm trying to answer in what you're saying there is number one is that when you're talking about urban versus remote communities, the research that we've done shows that the ear disease in remote communities is actually slightly higher. But despite that, the hearing rates and ear disease in the urban communities is at least 4, if not 5 times worse than the normal community. So because it might be 9 or 10 times in the remote communities, we don't think it's as bad in the urban population, yet the urban population is still 4 to 5 times higher than our counterparts that we're experiencing. And so from an urban perspective, we still need to be addressing those issues. From an urban perspective, it's really important to make sure that we are addressing some of those disparities in health to access. So if you're living in Newcastle or in Sydney or in Southwest Sydney, wherever, there's no reason why you don't get access to healthcare with the facilities. We have the facilities there. So the question I pose back to the government is, why are people living next to a hospital not accessing that hospital? Why is it that we're having high ear disease rates in communities where we can actually get health workers actually helping in that aspect? And that changes the whole dynamics, because it's a weird way to think about it, because we're then reflecting on the health system to say, why are we having pockets of all these problems, and why or how can we address those issues? And so when we come back to those and talk about those issues, yes, social and economic determinants are really important, but I still come back to, and it's probably a nuance in what I'm talking about, is the cultural determinants are really a slightly different way of talking about it, but it's really trying to get pride back into what we're talking about in health. And I think that's slightly different to what we mention in social and economic determinants, because it makes sure that we're doing the right things by the community for the community.
How do Indigenous people see Western medicine?
It's hard to say, because I think rather than looking at it in a very linear fashion, I try and encase a different aspect. So if I can flip that question around a little bit, health for Aboriginal and Torres Strait Islander people is really important. Health to us is, how do we make our kids successful and out of hospitals? How do we make sure that our mental and spiritual well-being is very encompassed? How do we make sure that we progress in society to be able to live the dreams that we want to dream and be a part and engage in society? And that's being healthy and well. And so another way to spin that would be, they talk about the physical, cultural, mental and spiritual well-being. It's just about being alive and well and not worrying about it. So that's the first thing. So when you think about it in that aspect, what we want then, or what we need, is a way in which we can engage our health system, which allows us to get the healthcare we need in a culturally safe environment. Now, if you go back to the 80s and 70s, a lot of the Aboriginal medical services were set up, and our archos were set up as a real crucial part of that aspect of healthcare, because the traditional mechanisms of getting health access was appalling and still remains appalling in some areas. And the reason for that is a whole multitude of experiences of kids being taken away, of being looked down upon, of a whole factor of things. And it still happens to this day. And people think that because it's yesterday or 10 years ago, that it doesn't happen. It happened to me on the weekend when I went in to see a kid, and a kid needed to go to theatres for a health ailment, which I won't go into. But when I said to the parents, we're going to take your kid upstairs to do an operation, it was on the weekend, the dad looked at me and said, "Are you pushing the bed up? When is the professor coming here?" Look past me, look past my female registrar, and look to the non-Indigenous emergency doctor, say, "When is this professor coming here? We really want to meet him to be able to help out." And you're kind of standing just like, "Hi guys, do you want me to stay here or not?" And so that to me was an unconscious bias, a little bit of lateral violence to look at me and judge me and how I was dressed. And it was a weekend, so I was in casual clothes, so I don't bear anything on that. And I don't think he meant it in any nasty way to the way I looked, but there was automatically this unconscious bias on the patient looking at me in the way that I represented, rather than I'm here to help. And so when I'm having that as a professor, I can only imagine what the community getting when they're facing some of these things. Another really good example, when a parent goes to the emergency department for ear disease problem, so an otitis media or discharge, and they're trying to get help for that. Yet the problem is that they will wait in the waiting room because there's such a long wait, because the heart attack went through, the stroke went through, unwell issues went through, whereas ear disease is not a high priority on the emergency triage. Yet as a parent or a mother, if you're waiting 6 hours in emergency just to see something for your ear, that's appalling. But I understand that triage, but we don't let the community understand that. And it's not just Aboriginal people that experience that, it's a general population. So we need to be able to adjust our health paradigms to make sure we're actually treating the right thing. Now, we've been talking about this for a long time in all aspects of health, because we want to put the onus back onto primary health care. Primary health care is going to be the bedrock of our health going forward. And unless we actually put more money into it and more resources in it, instead of stripping primary health care as we've been doing for the last 15, 20 years, we're not going to actually improve on the general well-being for all our communities. And that's Indigenous communities included in that. And so when you ask the question around, is there a fear of it? Yeah, there is a fear of it in some of the aspects, and the systems are there. But what I challenge is that the systems and structures that we have in place are not culturally safe for a lot of our people. But they're not culturally safe for a lot of people. I think that's where we need to get that nuance right from there. So it's not black and white of, X is no good. It's just those general things that we see, so that when we prioritize or try and make sure that we're trying to get this equity going on, we're not getting that resistance from the general community about, what, we don't need to worry about that. If we're serious about closing the gap, if we're serious about this equity in healthcare, then we need to look at ways in which we can address those aspects.
So would part of that be addressing the lack of Indigenous peoples in healthcare positions like yourself, or in the primary healthcare network?
Yes, I think what we need, and again, when I go back to the early days of equity and equality, or I probably should say equality, we looked at measures like community engagement and employment of Aboriginal people. Yet the people who are employed would be at the lower echelon of the hospital hierarchy, the cleaners, the ENs and things like that. And that's not saying that they don't do a wonderful job, because they're amazing. It's lovely to see those faces around the hospital. But we've also got to make sure that in all levels of the hospital, there is actually appropriate representation that engages people in the right manner. But also those who are making decisions, and certainly making decisions about health outcomes, need to have a lens of Aboriginal people when they're looking at that. And the thing that I always remind when I talk about this to my colleagues in these places is that we are on Aboriginal land, and our First Nation people have a right to healthcare. And we as caretakers, and we as the new generation, need to make sure we place that as a priority. As First Nation people, as the first people of this country, we need to treat them with the absolute respect that they deserve. And yes, of course, we need to treat all people with that respect, but there's a certain place in our hearts that we need to look after. And I say that thinking of my nan and the elders in my community, and how special they are to me, and how what they've been through. We want to make sure that happens, and happens in a real way, which is not tokenistic, which is not segregating or dividing our community, but really just encouraging, embellishing, giving them a big warm hug, and actually respecting that. And I think the wonderful thing about that is that if we get it right for those who are the most vulnerable in that aspect, then we're going to get it right for everyone, because then we start realizing that, hang on, we're actually judging people. We're actually putting systems up which doesn't allow people to come freely. And so then when you start challenging yourself on why these things are happening, it improves. And certainly hospital systems and health system is geared towards KPIs which are actually incongruent with healthcare. So if my KPI is a wait list for surgery, then that's the wrong KPI we're having. Because that KPI is really about numbers, about a procedure, whereas my KPI should be how many of the community am I getting access to, how many of these kids are actually getting through school safely, how many of these kids are actually getting all these issues addressed so they can actually push through school and get their employment jobs they need. That's the KPI I want to see, because that's what the community would hold me to expectation on. And so then we get all this elaborate dancing around wait lists, because we move wait lists around, which then makes sure that we get the funding and stuff. And that's fine. And as a good MBA kind of business person who leads in these kind of bureaucracy in the hospital, they do that, and they have to do that. I get that. I'm not saying it's not. But what I'm challenging them is that when they're doing all those things, and how do we actually spin it a little bit to make sure we're addressing those kind of issues. So rather than just having a KPI on the wait list, should our KPI include we should be looking after X percent of Koori people, we should be looking after X percent of refugee population, and that kind of number should be put on to your community, because each community is very different in those kind of aspects. And also the prevalence of disease should be taken into account. So if there's a high prevalence of ear disease, and I'm doing 100 operations every 6 months on ear disease, should that represent 20% of them should be Indigenous or refugees because they have the highest ear disease problem? And then put a KPI around that rather than just an absolute number. And that's a little bit more nuanced to really push us as clinicians then to look for the disease process we're looking for rather than that. And the other part of that then is that the public system can be so broken because it's so wound down that a lot of our smart young minds are just pushing straight in the private sector because they can get the work done, they can do really good work, and it's supported from their environment, but it doesn't address those vulnerable and doesn't address those people who need it the most.
Was the Voice to Parliament a missed opportunity to have conversations around this, or does it need to start with governments?
I think probably what the Voice did was, and it certainly wasn't a surprise to me, the Voice, I was optimistic, and it certainly created a lot of great conversations amongst my colleagues in relation to what we're doing and why we're doing it. And I think that was wonderful for that. What I'd like to see is an extrapolation and a continuation of those conversations, because I thought those conversations were very robust. Where we lost the opportunity in actually driving some of those changes by instilling that engagement. And when we talk about a voice at every level, and that's the same thing we talked about in the last answer, is that we need to have a voice when we're designing things to make sure that there is an Indigenous lens there. And I don't need to tell you or our, a simple example is your female listeners or to yourself, how many decisions are made around equity in women's health or equity in professions as women, and that decision hierarchy be all males. And so when you see that, you think, wow, that's incredible. Or you go to a medical conference, and you have these all white male panels talking about diversity in healthcare and equity and vulnerability. And you think, and I'm not denying that, because the people who speak on those are absolutely incredible and they're very good. I'm not denying that at all. But what I'm saying is that if you're actually challenging yourself on trying to improve that, then we need to make sure that we're engaged in the conversations so that we do have that representation on those panels. And now when I'm involved in conferences, we do that. We make sure there's equal male, female. We make sure that there's representation from Aboriginal people. We make sure there's representation of refugees. And so we really make sure that there's a fair and reasonable conversation around most of those things, rather than just saying I'm the expert or I know this. And I think in health, we're still very traditional. We're still very, I'm trying to think the right word, it's very hierarchical in medicine, and it filters down. Similar to law in Australia, law is very hierarchical. And so we still sit in that system of, if you're the expert, if you're the senior, then what you say goes. And again, I'm not saying I disrespect that, because I think there's a certain element of that we like, because I think of my senior consultants and my mentors as elders, but we need to make sure that we're bringing in the voices to make sure that we are not just being dictated to in a sense, but we're actually listening to other people and what they want and how they feel. So yeah, I think the Voice, we missed that opportunity to have those longer conversations. And the other thing it really brought out for me in that too is that I was shocked by some of my colleagues' responses on how strongly opposed they were to it. And it kind of broke my heart a little bit in that they didn't understand the principles of those aspects. And I think whether it's medicine's wore them down so much that they just feel like that way, particularly some of my more diverse colleagues were, well, we did it, so we're going to go through this kind of thing, and you don't get respect by getting a leg up and all those kind of things. And I say, well, hang on, it's not about a leg up. It's not about these things. The fact you've been through this, it really breaks my heart to hear you say that, because you've hardened up from the system in doing that. And the second aspect that I think where we had it with the Voice, and also similar with COVID, is it broke down a lot of the disparities and really uncovered and showcased how privileged we are. And so, the voice was talking about equity, and, it's almost like, I've got this privilege. Why would I give up my privilege to let someone else take that place? And it wasn't about taking someone's place. It's just about bringing someone as equal, but as almost like protecting it. Similarly with COVID, when you couldn't go to the pharmacy or couldn't go to your favorite restaurant or go overseas, people were aghast at that during COVID. And it was interesting having a conversation with colleagues going, well, think about some of the community that we go to and look after. When COVID's well and gone, which it has now, they're still not going overseas. They still can't go to the pharmacy. None of them have been to any of the restaurants we go to. And it's almost like that light bulb moment where they think, oh, wow, I've never thought of it in that aspect. And so when you've got a choice between medication, food, holiday, or, getting to the doctor's appointment, how do you make those choices when you have very limited funds? And, we as medical professions never had that. We don't have those restrictions because we're so blessed. And so suddenly when you're restricted by not finances, but restricted by the COVID epidemic, you start realizing that there's a lot more to not being able to get something than just getting it.
So my final question has two parts. First of all, how far have we come in terms of Indigenous health? And secondly, if you could pitch the Prime Minister about what needs to happen now, what would it be?
It's hard because it's such limited time to talk about such broad issues, but I think I'm an eternal optimist. And so I think we've done a lot of wonderful things, and you don't have to look around and what we see. The amount of the females coming through surgery is just amazing. The amount of Aboriginal doctors coming through medical schools is just amazing. Some of the kids I mentor at high schools are just incredible. And I'm sure I've seen our first president in some of the kids I'm mentoring. There's all these different aspects of the world that I'm living in now that I just am blown away by. My kids met one of my other friends who's another Indigenous doctor specialist. And, I said, this is a specialist. And they're going, yeah, but all Aboriginal people are, Dad, because my circle of friends is all these Aboriginal professionals. And, it's just weird for me to hear them say that because for me, it's still a novelty, whereas to them, it's everyday life. And so I think there's an evolution of what's happening. But the other part of that is that, which is probably the bigger part, is that I think Australia is coming along that journey as well, finally. And I think that's where I'm most excited. So my kids' friends at school have this passion for Aboriginal Australia that I was hiding from when I was at school, and that we were told not to talk about when we're going to school. And so it's a really different aspect of life that we're seeing primarily around the future of my children and the future of Australia. And so that, I think, is the optimism in me in the way in which we're changing things. And certainly we see that in the engagement around hospitals and engagement around research and engagement around ethics. There's a lot more conversations and engagement of Aboriginal people, which I think is wonderful. And I give a high accolade to the MJA for this issue of Indigenous health. It's been put together by a bunch of amazing, talented Aboriginal people. And, I feel so small when I'm around these amazing people because they just blow me away with the conversations we have. But for the MJA to give up that, I'm trying to think of the right word, editors love the control of their magazines and their publication. I get that completely. But for them to be able to say, you know what, this is something that we think is important and we want you guys to lead this was pretty special. And so, that wouldn't have happened 3 years ago, let alone now. So, there's an evolution of things that are happening that are changing the tide. So, yeah, I think I'm really excited by the difference. But that must be pushed by the governments and the bureaucracies to make sure this happens. And I think where sometimes I get a bit frustrated, I think it's happening quicker in the private sector than it is in the government sector. And that should be the other way around, or traditionally it's the other way around. And sometimes it's going great, let's leave it alone, rather than what else we need to do. And also there's a lot of competing interests in this area as well. So how do we make sure that we're doing the right thing by the community? And so for me, I talk about ears all the time, and ears are my passion. I love ears, and I think we should be doing that as number one priority. But I realise there are other priorities as well. But so for me, it's not about that with my family hat on. The answer is, what is the best thing that government should be doing to make sure families progress and their children progress appropriately across all things? And that's where the smarts come in then, because we need to work out what that is and what that looks like. And so my pitch to the Prime Minister would be, please don't forget, there is this huge disparity. So fed up of hearing closing the gap reports where we're not making any grounds whatsoever. what do we need to do? How can we as soldiers of the government work harder to actually achieve what we need so that all our kids are equal?
My special guest has been Professor Kelvin Kong, the 2023 NAIDOC Person of the Year and Australia's first Indigenous surgeon. You can find more podcasts on our website at mja.com.au or wherever you get your podcasts. Thank you so much for listening.